The events leading up to Josiah's surgery started when he was really young, when he was just 3 days old. And he started having some seizures in the hospital that were related to low blood sugars. At that time, he was put on some medications to try to control the seizuring, but it was unclear at that time what the actual problem was. So after 2.5 weeks in the hospital, he came home with us, but was still having seizures at home.
His problem was that he was overproducing insulin, and the outcome of that problem was the fact that he was unable to maintain a normal blood sugar. That's extremely important for babies because they will not have normal development of their brain if they don't have a normal amount of blood sugar available at all times. It's a serious problem, but extremely uncommon one. In fact, we had not had another baby with a similar problem here at the Children's Hospital over the past 10 years.
And as a result of all this, his pancreas was removed. Most of it, 97%, 95 to 97.
The surgery was done about 2 weeks after he came into the hospital. The next 4 to 6 weeks were pretty rocky for this little guy because the problem still wasn't completely solved. The pancreas does another very important thing as well. It makes our digestive juices.
Josiah's care really hinged on two things: getting medication and having the proper kinds of feeds that he would be able to maintain his blood sugars on. So we came to a regime where he would get the medication, and in 2 hours he'd eat, and then he'd get medication and eat, and that was happening round the clock.
Josiah, when admitted to hospital, it was discovered that he needed a very specialized formula to control the amount of leucine he was receiving on a day-to-day basis to promote growth and to assure that we did not aggravate his condition and elevate his blood sugar levels. The parents were then instructed and shown how to prepare the special formula so that he would be able to go home and be managed in a home setting.
The medication that we have ended up giving Josiah to allow for control of his blood sugars is called somatostatin. It is given by injection, or else it's given intravenously. In order to give it as frequently as he requires it, it meant giving it 6 times a day. That's why we investigated an alternate route of giving him the medication. We are now using a pump.
It's a small infusion pump, roughly the size of a cassette tape, but twice as thick, that is in a pocket in a t-shirt on him, and then just a small line runs into his side, and there's a little Teflon cannula inserted in the fatty tissue of his skin.
It's been really it's been a life-saving device for him. That's enabled him to be home, which was where we wanted him, obviously. Originally, when we came home, we were going in every week for an appointment with the endocrine department with Dr. Trussell. Now, we're weaned down to 1 visit a month. We were living in the Okanagan prior to coming here, and the Okanagan has good hospitals. But if we hadn't been in Calgary, Josiah probably would have died, because we needed the expertise that the doctors and the professionals here could offer for Josiah's care.